National Institute of Communicable Diseases that South Africa recorded its first coronavirus infected person who had been traveling from Italy and had gone to see a doctor, and the doctor immediately realized that we could be dealing with something serious and sent him in for the various tests and all that. So it's now been confirmed that we have a person within our country who has tested positive to coronavirus. Would like to applaud the capability of the NICD for having acted very quickly and swiftly, and also having informed the minister, who immediately informed me. I informed him that he should go ahead and make the news public in Parliament so that South Africans are immediately informed, so as to avoid fake news spreading around the country, and also to have a level of transparency about this virus that is spreading around the world. We're not the only country that is affected. Many more countries have been affected, and it looks like it will keep on spreading to a number of countries in the world. The key question is whether we are ready and prepared. And just this morning, I was quite impressed with the level of preparedness in terms of being able to identify what it is and immediately having the person isolated. So we are gearing up more and more as a country, and the report I've received from the Minister of Health has demonstrated to me that we can be more alert, and we can go to higher levels of being alert. And obviously we did this in terms of revealing this immediately so that there should not be panic. South Africans should not panic. We should be alert so that if people either show signs of some of the symptoms, they should immediately be able to get medical assistance. And all our medical care people, whether in the private sector and in the public sector, are being informed that their alertness in identifying this disease must be at a much higher level. So we should, as South Africans, be rest assured that government will demonstrate its seriousness in terms of dealing with this matter, and we will continue to be transparent. And at the same time, we want South Africans not to panic, because we will continue to ensure that we handle this matter with the necessary care and capability that it requires. So thank you very much.
Thank you, Mr. President. So I promised them that we take 2 questions, but I think you've been very clear. There are no questions. Vuyo, you'll be the only one.
Just a quick one, Mr. President. You satisfied yourself that the reports you've been given are in fact accurate? Have you sought perhaps the assistance of outside parties to evaluate our systems so that you are really assured that what you've been told is in fact what is true? I'm thinking of that ESCOM situation.
Okay. Well, this was revealed to us today, just a few hours ago. And what we would ordinarily do with a situation like this, to be immediately in touch with the World Health Organization. And the minister has done that. We are in constant contact with the World Health Organization, and we also have South Africans who are working at the WHO who keep us up to date about this virus. So the help that we would need to get would in the first instance as a country come from the World Health Organization, but at the same time there are a number of other countries that have already gone through certain processes in terms of either being alert, containing it, and China is one of those. They have been able, having had the bulk of the people who have been affected, they've been able to show ability to contain it, and we wish them luck in carrying on with that. So we will also be of other experts around the world, and we are just at the beginning of this, but we have been in constant contact with the World Health Organization. So, and we will keep informing South Africans very openly and transparently about the number of steps that we will be taking, because this is it will turn out to be a national crisis, and we do need to keep our people informed. And it will have huge impacts on a number of things. It will have huge impacts on travel. It will have a negative impact also on our economy, which, as we all know, is in a very, very precarious situation. It is already showing signs of having a negative impact on our tourism as well. Internal travel, people are already making other arrangements, and people I met this morning were saying that, you know, flights to South Africa were already showing signs of more seats being available when ordinarily they didn't show that. So the effect is going to be big, and South Africans need to be prepared, but more prepared for ourselves, being alert. And there are quite a number of things I'm told we have to do. Wash our hands continuously, and make sure that we keep on doing things like that. So thank you very much.
Thank you. Thank you very much, Mr. President.